Hi, my name is Jose Delgado. Welcome to my channel, and today I'm going to talk about a publication that was released in 2012, a Journal of Control released. So there are currently challenges in cancer chemotherapy. Some of them are toxicity at normal tissue, poor drug delivery at the tumor site, and limited tumor specificity. To address these issues, the authors of this paper employ drug delivery systems called liposomes. So liposomes are able to encapsulate a chemotherapeutic called doxorubicin, and when they are heated with a range of 40 to 42 Celsius, they are able to release to break the liposome and release the cargo. So the objective of this study was to know what happened when rabbits that has liver tumors in the thigh muscle are treated with liposomal doxorubicin and MR-HIFU. MR-HIFU is magnetic resonance high intensity focused ultrasound, and this means that there is an imaging of MRI of the patient or the animal to locate the tumor. Once the tumor is located, an external source of high intensive ultrasound energy apply heat to that area. So after the injection of liposomal doxorubicin, this construct travel through the bloodstream and arrive to that place that is currently heated. So that triggers the release of the doxorubicin at the tumor site or at the desired site of therapy. So they tested three groups. Three groups of rabbits. One is using free doxorubicin, other is using just liposomal doxorubicin sensitive to temperature, and the number three is using this combination therapy of liposomal doxorubicin and this MR-HIFU. So as you can see is in this image, there is an MRI imaging. So when there is an external source that is applying ultrasound energy, and this area is focusedly and locally heated, so when the liposomes with doxorubicin arrive, they release the drug at the tumor site. So what they found is, so they treated, as I said, three groups of animals with free doxorubicin, just the liposomal dox and liposomal doxorubicin plus HIFU or high intensive focus ultrasound. What they found is to try to calculate the amount of doxorubicin at the tumor tissues and try to compare the amount of doxorubicin with the different treatments, and they found that in case of the combinational therapy, the rabbits possess more doxorubicin in the tumor. So they performed other experiment comparing the same treatments, and so they try to calculate using high pressure liquid chromatography the tumor, the dox in the tumor and the doxorubicin in the normal tissue, so to try to evaluate specificity. And they found more specificity in this combination therapy of LTSL and HIFU. They also perform a spatial distribution using a fluorescent microscope. So taking advantage of the fluorescence of doxorubicin, they were able to see in histological samples of the tumors where is located especially the doxorubicin, and they found that in case of the LTSL plus MRI HIFU, combinational therapy, the tumor has or the tissue has more doxorubicin over the place, inclusively in the core of the tumor, in comparison with the other treatments. So in conclusion, they say that this MR HIFU technique is potential to be used in clinics, to be translated in clinics as an image guided method for drug delivery of solid tumors. Thank you very much.